We have been trained to believe that we are the leaders of every team.
That's right.
And that we should know more than anyone in the room, or we must not be a good doctor. Throw that out. And where I found part of my superpowers lived was to stop feeling like I had to lead constantly.
This is Inspiring Women. I'm Lori McGraw, and I'm speaking with Dr. Saria Saccocio.
Ciao, Bella.
Ciao, Bella. We're not here in Italy. We're here in Nashville. We're here at the Nashville Sessions Conference, where, Saria, you've been speaking, and you were talking about Essence Healthcare, where you are today. You have an enormous amount of experience as a leader, as a physician of large-scale organizations. You've scaled many of those organizations, but now you're doing Essence Healthcare. What I want to start with is, why Essence Healthcare? What are you doing there? Because this is a complex space of Medicare, Medicare Advantage. And I don't know if you were expecting all the disruption that you're feeling right now, but it's a complicated time, and I want to get into that.
Well, thank you. First of all, Lori, I love the idea that we're focusing on women leaders at Nashville Sessions.
Yes.
What an exciting time, and what a fantastic conference this has been.
So just by the way, last year at Nashville Sessions, I believe they had 3 women powerhouse speakers. And this year they have yourself, including quite a lineup. So I will say, kudos to Sessions for bringing more powerhouse women like yourself on the main stage.
It's certainly been a dynamic experience with just phenomenal people out here.
Yeah.
As we see on the screen, but in the room, in the forum, really great stuff is happening here.
Yep. So tell us about Essence Healthcare. You could have done anything. You've led, Elevance. Let me just go through some of these names. Chief Medical Officer at Life Point Hospitals, Carillion Health, Bon Secura's Health System, Elevance Health, Caramore Health. And that's just half of them. So you could have done everything, anything. Why Essence Healthcare?
Well, Lori, I'll say it's been quite a journey, and I have enjoyed every step. What I am mostly enjoying and so excited about is Essence.
Okay.
Essence is a 20-year-old, 21 now, we're entering that year, Medicare Advantage health plan. Mm-hmm. It's regional, and it is such a phenomenal group of individuals, of team members who believe in this work, believe in our mission, and serving every member through high-quality, high-touch care and partnership with our providers and health systems. I have not seen an experience that is so tightly collaborative as I see with this health plan.
Okay. So in terms of that, maybe compare perhaps sort of what is different, because you've been in the space of delivering care. You've been in the space of health plans before, as well as provider systems. So what is so different about what you're doing at Essence?
What is so unique about the experience at Essence is that we have the ability to be broad scale across several states, but small enough and boutique, if you will, to think outside the box and to quickly make change, and to partner with physicians. It's the type of organization I hear our physicians and our partnerships say often, I can pick up the phone and call you, Saria. I don't usually see that. I don't typically see health plans wanting, seeking, and asking to meet face-to-face with physicians and partnerships. So for me, it's all about the relationship. It's the people that we work with. And that's what makes us so special at Essence. And that's how we are such a high-performing Medicare Advantage plan year over year over year.
Okay, but what's changing in the space of Medicare Advantage? Okay, has anything changed this year?
Maybe just a little bit, maybe just for a minute.
Okay.
In fact, every day it's changing. This is an environment I love, though. I love that we are constantly changing, because that is healthcare, be it technology, administration changes, policy. What I always strive for is looking at what's the motive behind it. And I truly believe that why we're seeing changes is because our system is so broken.
Yeah.
And we may not always agree on how we get there, but we also have that creativity to derive the highest quality care for each member. And I think that's what we're being charged to do and being held accountable.
But how are you doing it, Saria? So we're in a time where we know that costs are going up and up and up in terms of care that's being delivered. We know that systems are more complex to navigate for people. You're dealing with people on Medicare Advantage plans. So it's an older population, perhaps not as tech savvy as you might want them to be. So with that landscape, can you just sort of like square the circle of what complexities are you trying to solve for to deliver what is a level of care that you're very proud of?
Mm-hmm. Well, what I will say is while the headwinds change, the game is still the same.
Okay.
What I mean by that is when you sit at a table with people with the data available and you find out who's doing it well, how you replicate that, the tools change, technology has changed. AI is more available to us than ever before, but it's the same game plan. At the end of the day, I find sometimes we overcomplicate things by trying to create a whole new roadmap every year, year after year. So I just call it simplification and getting back to the relationships. I think about, for example, pharmacy. One of our headwinds is the incredible cost of care today. Well, what we have done is circle up our physicians. What are the pain points? What are the frustrations? Where do we run into issues? We know some of these medications are expensive. For example, I can think of one in the oncology space that is so incredibly expensive. Well, at the same time, we want people to provide and receive the most excellent care.
Yeah.
So we got to find a way around that. Where is it most appropriate? And serve that up in an efficient way. And when you're partnering with the physicians to find out how to serve it up, we've just eliminated several of our prior auths. What that does.
Thank you for doing that. My goodness, right?
Amen to that work.
Yep.
But we've been very thoughtful about what we eliminate from a prior auth. And all of this happens in partnership with our physicians who make that final call, the decision. I was just on one of our JOCs, a joint operating committee, with one of our partners to look at quarterly, what is performance? Their question was, well, how do we know we are eliminating the right referrals?
Yeah.
And so we were able to walk through a conversation of this is how we do it. And quarterly, we're going to bring these numbers back to you and we decide together what that utilization looks like. I've also been in a place, and this is why I say it's so simple. If you focus on the member and keep them at the center of excellence, we'll make the right decisions at the same time. So some things will be more expensive. Pharmacy is more expensive.
Yeah.
But I'll also say when a family member of one of our health plan recipients calls and says, I need my family member to go to a high quality skilled nursing facility, we make it happen. If you're in network, out of network, sometimes you have to make those exceptions wisely. But if we do it based on the data in partnership and trust, that's the simple formula.
How can you just explain how, like, that data issue? And I was just having a conversation at actually lunch here at the sessions about, the issues in terms of like lagging indicators with data, claims data, which is always, seemingly behind the curve of, 6 or 9 months in terms of being able to actually understand what's going on. Can you just talk about how you're looking at data and where the opportunities are, maybe with whether it's with technology or, how are you looking at it differently than perhaps you have in some of your prior experiences?
Sure. It is a challenge with medical cost trend.
Yep.
We know we're going to be probably 60 to 90 days in arrears with that conversation.
Yeah.
What we try to bring to the table, though, is here's how you performed in quarter 2 versus quarter 3.
Yeah.
Not just a year over year.
Yep.
That doesn't tell us what worked or what didn't work.
Yeah.
And in fact, when we do this.
And is that different? Was it previously sort of year over year trends for you? Have things become more sort of current just based on today's landscape? I mean, I'm asking because I do not know.
Yeah. Well, yes, we have changed how we review the data for that reason. We've done 12-month rolling in the past. What we recognize is there's seasonality changes.
Yeah.
Or we work so quickly that what we implemented in Q1, we need to see what it looks like in Q2, not just a year over year approach.
Yeah.
It used to be, Lori, to your point, the same plan.
Okay.
Right? So what we would do with the playbook is work harder.
Yep.
Just work harder.
Work harder is always a good chance.
Just do more.
Yeah.
And what we've recognized is it's not always doing more. That efficiency can create some impact that we hadn't seen in the past. And that's the feedback we've gotten from our partners. As I mentioned, the call this morning, while I was sitting in my hotel room was, thank you. Thank you for giving us actionable data. And in our meetings with these partners, we talk about, we had a member who had 3 hospital stays. Care management has reached out to them. We have a program where we go into the homes. What's missing? What's not working? And we can share that story real time so they know what's happening and what's not. The other thing I'll share is we talked about medical cost trend. What's different for us is we work on a technology platform where we're sharing up to date. In fact, our quality person was sharing on the call. I just looked yesterday at the data, and here's the latest performance in your gaps in care for quality. Measure by measure by measure.
Wow.
You don't see that with every health plan.
Right. No, you don't. And so in terms of, again, is this because of Essence and what Essence is doing? I mean, why is it different? Why are you able to do it so differently, at Essence for, again, based on prior experiences that might have had even more resources than perhaps you have available today?
Well, I will say when I worked on the health system side, it has always been a tremendous frustration. Whether you're gathering the data within your EMR in a health system or you're relying on a payer to give it to you. It used to be good enough. And now that we're in the value-based space, I was just reading an article this morning that talked about value-based care is no longer a nice to have. It's a need to have.
Okay, but we've been saying that for 15 years. So do you believe it? I mean, you're pretty expert in this space. So in terms of value-based care, are we really there after all of this discussion? We kind of have to be, don't you think?
And some of us are. And the truth is in the pudding. Well, I will say cut points for stars and that performance, the bar continues to get raised, which is a good thing. I will say, because that means that people all over the country are receiving higher quality care than they did last year and the year before and the year before that. It's harder. For sure. But we absolutely need to deliver that data. And if I can look and say, for breast cancer screening this morning on the call, and we're heading into breast cancer month, so all those women out there, get them checked out. Check the tatas. Let's make sure we stay healthy. I can't overemphasize this point. My mother and my sister and I have this conversation because my sister at 45 was diagnosed with breast cancer. So, and it was actually this time of year, Breast Cancer Awareness Month, that we did this focus. When I can say you have 5 women who are missing this gap and are at risk for cancer, that's a different message than go check a list and just do better. And make sure you ask the question.
That is much more direct and actionable. So let's go back to a bit about you, Saria. So you are a physician, you are a practicing physician. After all these years of leadership in terms of all the roles that you've done, it's been important to you to continue to be a practicing physician. I find that amazing. It is a very, very difficult thing to do in terms of managing that balance. So first of all, why do you do it? And why do you continue to do it?
Well, first of all, it is an ultimate privilege. It's been over 2 decades that I have been a physician, and it is a tremendous honor to be a family physician. And patients let you into their lives in ways that you can't imagine in that exam room. And I hold that as a sacred relationship with patients. I also find that it keeps me grounded in the experience, the vulnerability that patients see, experience, and feel when they're in our health system, in a broken health system, and why I think it's so necessary that I do it. There's some of my favorite days of the month whenever I can go in there and connect. And I'll share an example for you. This one gentleman who landed in Greenville, South Carolina at our Greenville Free Medical Clinic, where I do see patients. He was a military veteran, was living in Alaska, came back to South Carolina to take care of his dying mother, and had no way back home. Now, this gentleman, you might say that refilling his diabetes medications were most important, very important, managing his blood pressure, serving up his mental health needs. But that day and that encounter, the most important thing was a pair of socks. And I share this story, and I share it with my kids. One of my kids is interested in being a family doc himself. And I said, Carter, don't ever forget to see every person and to really find out what they need. And that's what the free clinic does for me, because when I removed this gentleman's socks to check his feet, he has diabetes, and what I saw were the signs of someone who probably had one pair of socks.
Mm-hmm.
And when you can preserve the dignity of that person, and then in the middle of a visit, a nurse runs out to the Dollar General and gets an extra pair of socks and connects him to one of the local nonprofits, so he has the socks to take care of his feet so he doesn't lose them.
Yeah.
That's what healthcare is to me. It's about all the things.
Well, that is such a warm example of what whole person care looks like, the whole person, the dignity of the person. And you also know, I mean, that's an amazing story, but you also know that the complexity of healthcare, we've lost so much of that human connectiveness that's in healthcare, particularly for physicians, who have gone through an enormous amount of increased burnout, and perhaps we're getting a little bit better, but that's still there. So how do you take that incredible experience of meeting the needs of that person where they were in their time of need, and how do you bring that to your work so that it can scale? Because you also know that there's costs that need to be managed, and the complexities and reimbursement challenges and regulation challenges and compliance challenges. So how do you bring something like that, and how do you bring it into essence so that that is what can be delivered to so many people that you serve?
Mm-hmm. Well, I'm going to go back to our values as a company, because this is something I live by. I strongly feel that if you in your organization cannot recite your mission and your vision and values, then it's too complicated.
Yep.
It's not meaningful, and it's simply wallpaper.
Yep.
And we were just in a meeting with our leadership staff and our growth team last week, getting excited about this work. And it came down to our values of excellence in the quality of care. We are a high performer because we don't give up until we get it right for every measure, every member. We focus on collaboration with our partners, and most importantly, our members. What's new for us is community engagement at the level. And this is something I brought to Essence with my passion for community engagement and the overall care of the person. And the most importantly, integrity. And that's what I'm proud about for Essence, is that for me, integrity is doing what you say you're going to do. That follow through is critical. It shows in the work. But here's where I'm going to make it personal, Lori. I think about our executive leadership team meeting this week, and we shared a video, an audio. What am I saying? It was an audio file of people who've experienced Essence. We plan on sharing this at our town hall. And in fact, our SVP of operations was saying she listens to it every few days, because this connectedness back to the member and the impact you're having sets us up to be successful. Of course, we have processes in places. We just talked about that. The technology for real-time intervention.
Yep.
The secret sauce is a team that is so connected to values and mission that they live it, breathe it, and they know, each employee knows how they contribute to that mission every day.
Okay, that's hard to do while you're balancing growth, while you're balancing scale. So that is amazing that you're doing it. You're also doing interesting things like connecting your members with wearables and things like that. Can you talk about what that is, the OURA rings, and how that's helping you deliver at the level you expect to?
Yes. This is such a fascinating
I see you've got
space.
your OURA ring on.
That's right. I gave OURA the finger and have learned that, that's the other thing is I feel like we have our own real-time learning lab and why we believe in the OURA ring. There are so many wearable devices out there. Now, for years, as a family doc, I've been checking blood pressure logs and glucose logs. I've been checking people's Fitbits and their steps that they've walked. What's different with our experience with OURA is it's given us a level to connect with members in a language and conversation that we probably haven't in the past.
Yep.
But the tricky part is then translating that to a clinical picture and impact. So what do I mean by that? So for one, we've started on this campaign just in 2025.
Okay, so very recent. Yeah.
Very recent.
Yeah.
In 2025, we started with a couple of our products or availabilities for members to wear an OURA ring. This has helped us address health equity by saying everyone and anyone as part of that product, and we've expanded for 2026, which is so exciting, to say if you're an Essence member and you belong to one of these products, not only do you get the ring, we also cover your annual subscription.
Oh, really? Okay.
Yeah, so we eliminate
Any barrier.
financial barrier. Now, the other thing is digital health literacy.
Yep.
This is a tool to help teach literacy. It is that easy. So when you look at the age of members that we serve, 65 and above, 3 out of 4 of them have a smartphone.
Yep.
Now, I still want to work on the 1 out of 4, but that 3 out of 4, they're pulling out their phones.
Someone else is helping them. Somebody else has a smartphone in their families, I hope.
Yes. And let's not underestimate their ability to pull up pictures of their grandchildren.
Yep, exactly.
They're doing it. My mother, Mimi, I always refer to Mimi as she is the prototypical Medicare Advantage member. And I ask her oftentimes what she thinks about the work that we do, even though she doesn't live in one of our areas. But I say, can you do this? What do you do with this?
Yeah.
And she uses her smartphone. But what's so exciting, as I mentioned, this is teaching digital health literacy.
Yeah.
To say, are you looking at your phone? What are you looking at it for?
Yeah.
Now, the one thing I haven't mentioned yet, which I think is so critical, again, this translation from a wearable device or a wellness device to clinical impacting tools is starting with sleep. So we all do it. We do it every day.
Some of us do it better than others.
That's right. That's right. And I like to refer to this as what happens between the sheets needs to be discussed in the exam room. This is a healthy part of living. And I share Mimi as an example because for 17 years, she used sleep medication. And we've all read now, we've all learned that these sleep aids can increase your risk for mortality, for dementia, a number of problems. And when I get feedback from our members, what I've heard over and over again, Lori, is it helps me sleep. It's helping me focus on my sleep. It's helping me deliver and develop healthy behaviors.
The ring and the digital literacy helps with the sleep for people 65 and above. That's what you're saying. Really?
Yes, that's what I'm saying. And then the translation over to the clinical side, we've discovered with our physician advisory council, who, every single one of them has given the ring. Given the finger to the OURA ring. And one of the comments that I received from one of our physicians is, it's helping me with my sleep apnea. So notice the change, and it's helping me sleep. Because a member's not necessarily a clinician. To translating that to a physician connecting to why the ring is important. And that's not something that you see with every wearable device. And it's gone with an intentional connection back to how can we help connect better that conversation and make it easy. So they're helping to devise for us, how do you look at the population? And when a patient's in the exam room and wants to talk about their sleep, I can pull up that dashboard. I know how many times their oxygen blood level dropped below or into a dangerous level. Maybe I need to screen them for sleep apnea or some other sleep disorder. That's the difference.
Okay. So I think we've established that you're passionate about your work. You're passionate for those human moments of connecting to meeting the patient or the member where they are, helping them, having them become more digitally literate in terms of managing their own health, which is wonderful. Let's talk about you. So let's talk about the leadership journey. So the years of leadership. How are you leading today that is different, perhaps, than you did maybe even just 5 years ago, not that long ago? And I say that because, we're in a very significant administrative change in terms of, how policy changes are affecting all businesses, all plans that are out there. It's moving, faster, slower, but it's definitely different. We have cost issues, we have complexity issues. And it is my view that women leaders are particularly well equipped to deal with this moment in time by leading boldly, by leading differently, perhaps, than we have before. That's my thesis. So I want to know from you, how are you leading differently, again, in this moment in time where the challenges are simply greater than I think what anyone has experienced before?
Well, when you give the time range of 5 years, I go back to 2020. We all know what happened in that space. And I remember when I had a dramatic impact in my leadership skills 5 years ago. So it's ironic you picked that period of time for a number of reasons. We had to change. We had to flip what we do on a dime. We had to get creative and do things we'd never done before. And I will say the beginning of COVID, I lost a lot of sleep. I'm probably glad I didn't have an OURA ring because my score and performance for readiness
More stress you didn't need.
would have been awful. Definitely a thumbs down. Now, that being said, I remember this moment probably probably within the first 3 months for sure. Working nights, weekends, of course, all day long, starting in the morning, not sleeping at night, wondering, how am I going to create a solution? How am I going to solve for this? How are we going to deliver care to, at the time we had, where I was, we had a catchment range of 1.3 million people. That weighed so heavily on me, not only as a leader, but a family physician, and knowing people needed health. And I had this moment after I had been working with a phenomenal team, one of the best teams I've ever worked with, that were creative, innovative. And what I started to see shift was a brain drain to a recharge. And it's kind of like, those superchargers, those battery things that you don't even have to plug in and you get this boost. This is how we started to operate as a team. And so what clicked for me was, maybe I don't have to have all the answers myself. Perhaps I'm not the only one who comes up with solutions. Now, that may sound obvious or obtuse, but let me tell you this. As a physician in training, and I do believe it's gradually changing, we have been trained to believe that we are the leaders of every team.
That's right.
And that we should know more than anyone in the room, or we must not be a good doctor. Throw that out. So lady physicians, if there are any lady physicians listening to this, remember and throw it away. And where I found part of my superpowers lived was to stop feeling like I had to lead constantly and do a quick scan around the room. What is the expertise and how do we solve it together? And literally overnight for me, Lori, I slept. I slept well, knowing I don't have the answers for tomorrow, but I have 100% confidence that I've surrounded myself, and we as a team have surrounded each other to build back and boost that energy and solve for problems that we've never solved before.
And do you bring that into how you're building teams today? Because it does sound obvious, but it is also very clearly, anybody who has approached leadership, been in leadership at any level, knows that there is a difference between being the one and only person with the answers to making the team the actual unit that accomplishes something. So have you been able to carry that change in terms of how you think about your leadership style into building new teams?
Indeed. And in fact, it's frankly how I keep from burning out. And so a phrase that I tend to follow, especially when I get anxious, I'm not saying I don't get anxious whenever we've got these big problems to solve today, I have to remind myself to let go and lead. Leading is not always directing. Leading is inspiring, empowering, and enabling everyone to sit at the table, speak up, show up, and do things, and know that they can do things too. Build everyone else's confidence. And as you said just a moment ago, I've been with Essence for a year now, and I'm so blessed to have this team come together that wasn't together in the way that it's organized today. And what I am most proud about is the work that they do, the creativity that they have, now that they're working across swim lanes and doing things together. It is phenomenal. And you can see by the smile
you're
on my
beaming.
face.
You're absolutely like beaming and beaming with pride. And that is such an awesome thing to have as a leader in terms of pride of the team that you lead and are a part of. Let's close out this conversation. I can't, as just someone, has accomplished what you have. If you look back and think about, all that you've learned to be the leader that you are today, what advice do you give to young women, whether it's younger physicians or earlier stage leaders? What is your great advice for them?
It's really simple. What advice I would give all of us as human beings, and especially in healthcare, high performing and always disruptive change, is don't forget to be you. Let's stop trying to be someone else. And whether you're a female or not, social media can cloud our judgment of what we're supposed to be or how to be, or you can look around the boardroom and see other high performers. You're at that table because you are you and not who someone else is. So bring yourself to work, bring your whole self wherever you go. Be grateful for the opportunity to sit at the tables that we sit at, but be you.
That is a great way to close this Inspiring Women conversation. I've been speaking with Dr. Saria Saccocio, and this has just been excellent. So thank you. Thank you so much.
Thank you, Lori. This is so fun. And now I'm charged for the day. I got my booster pack on.